Hey everyone, my name is James. I'm from Canada and I've had Lyme for a year and 2 months now. Before that, I was a healthy individual, 25 years of age. I was graduated from university from engineering, and it was in December 2015. I went on vacation with my friend and came back severely sick. I had a bit of sore throat, and then for a day, then I had fever that lasted about 2 weeks. It was about 40 degrees centigrade, and then when I saw my doctor, he said you might have the flu, but the fever kept going, and then I had swollen joints, swollen, painful red joints. Started off from my knuckles, went on. I had headaches, ringing in the ears. I had facial numbness, and I had all these symptoms that I was also diagnosed at the ER for the facial numbness. I had this extremely painful episodes that my eyes would ache so much that would actually wake me up at night. I was tested for all sort of, diseases like lupus, autoimmune diseases like lupus, rheumatoid arthritis, different STDs, and they all came back negative. I went to my family doctor, requested that, listen, I was at this countries not a long time ago, I was healthy, and now I'm sick. Could you test me for things that I might pick up? He said, no, you're fine. This is a flu. So by February, this happened in January, by February, I woke up with extremely bad chest pain. I went to the ER and they diagnosed me with pericarditis, which is inflammation of the heart sac caused by a virus or a bacteria. I had shortness of breath, I had heartbeat over 100 beats per minute when I was laying down. It felt like I was running. And I had all sort of problems. My joints hurt so bad that I couldn't walk from here, a feet to the washroom with 2 feet. I felt like a 90-year-old guy. So I went back to my family doctor, requested please send me to a specialist like a rheumatologist, infection disease doctor. He said no. I kept going, and he finally decided to refer me to a rheumatologist. And in Canada, it's really hard to get to see a specialist. When I got my referral, I had an appointment 2 months after, although I was really sick. And then I decided to go see other doctors because my family doctor told me this joint pain is from reactive arthritis, from the flu, which I didn't buy it. So I went and saw other doctors at walk-in clinics, and they tested me for something called HLA-D27, which is a gene that if you have it, you're more predisposed to have reactive arthritis, which I didn't have. And it wasn't getting better, it was actually getting worse. I had neurological problems, brain fog, all sort of stuff. And by March, I was losing a lot of weight. I lost about 40 pounds within 3 months. So I was thinking, what if, this is something more serious? So I went and changed my family doctor, and he said that, you know what, I think this might be some sort of cancer that we're not sure where it is, but we're going to test you as a CTA scan from your head to your toe and find it. Which I was a bit concerned of the radiation exposure, so I asked for an MRI, but he said that he can't really do it, and you need a specialist, permission. Even if he had to write me an MRI, it would take a month in Canada to get an MRI done. I was about to get it privately done, but it was quite expensive, so I got a code to do it abroad, and it was quite cheap. So I went abroad, tried to do an MRI, everything came back normal. And then, when I was there, on the last day coming home, I hit my head somewhere, I had a small head trauma, but I started bleeding, brain bleed. So I ended up 14 days in ICU, somewhere that no one at my age or anyone, period, should be there. It's just a place that people usually go there that are critically sick and about to die. I was there alone, my family were back in Canada, so it wasn't something nice to be at, but what I did, which made me more depressed there, is that I Googled the chance of surviving a brain bleed. The type that I had was 5%. So I was quite scared, that I'm going to die somewhere that, I'm alone. Anyways, so when I was there, the doctors noticed I had ST elevation in my heart was beating really fast, my spleen was big, I had fever. So they saw me, they sent an ID specialist to see me. She saw me and she said that, I'm gonna run a couple of tests, but I'll come and see you tomorrow. She came and saw me the next day and she told me, look, you have a textbook description of Lyme disease. I studied in the US, that's the doctor saying. She said that she studied in the US and then she knows this. And she was surprised that I wasn't diagnosed in Canada. So that led me to actually make a phone call to my voicemail, Canadian voicemail, see if anyone left me a message that the test results are back. And I had 5 to 6 messages from the laboratory and CDC telling me that the results are back. You got Lyme, that is positive. I flew back, I saw an ID specialist, they gave me doxycycline, and everything cleared up in 8 days. I was fine in June till August. In August, I had fever and pericarditis again, back to square one. I was given doxy again for 10 days, felt fine. Then in November, I had brain fog, fever, MS-like symptoms that my feet would give out. I was fatigued to a point that I couldn't walk or talk to anyone. And shortness of breath, and all sort of other problems. During all this time, it's just that it was quite hard to get a diagnosis. I remember when I was sick in January 2016, people thought that was Lyme. I mean, my family doctor back then, the old family doctor, told me, I think you're just stressed, you have anxiety. And I mean, how would you have anxiety that causes you fever or joint pains? I mean, the friends that told me you look fine, you're just making this up. My family members that just told me you're just stressed. But why would I be stressed? What would I gain out of being sick or pretending to be sick? How would being anxious cause you to have severe joint pains, fever, your spleen gets big? Why is it that if I have anxiety, why is it that when I'm given Xanax or lorazepam, none of my symptoms go away? I have, say, tachycardia. So in November, I saw the ID doctor and he told me he can't do anything more about this, and what I have is called post-Lyme syndrome. I have to work out. Which, again, this is a fight that I had with the doctors, fight against the disease, fight with the family members, fight with your friends. And worst of all is fight with yourself, with the depression that you have to fight every day. You compare yourself to what you were before you were sick, and it just brings you down. So at this point, I was really desperate for getting treatments done. When I saw another ID doctor, he tried an IV antibiotics, ceftriaxone, which I was allergic to, second dose. And then we tried penicillin, which didn't quite work with the pump. I mean, I got it last week. I just had a PICC line last week. So we're switching into another antibiotic tomorrow. And I'll post more as we go along. But last message is I'm trying to get treated for this disease, whatever it takes. Meaning that if I have to go abroad to Germany, to Cyprus or somewhere else to get treated, because of the health system here in Canada, I've risked my life going abroad and dying because I was looking for an answer. Because the doctor that I had didn't listen to my symptoms, they didn't believe that I actually was sick. And that's mainly because they see a healthy individual and then they just assume it's a stress or anxiety. But I had no means to be stressed. I mean, I graduated university, I was about to start, a different path, go work. I mean, nothing to be stressed about, just came back from vacation. So yeah, this is a video for people that are sick to keep pushing for a diagnosis, don't give up. And if you don't like your doctor, just change them. And this is to raise awareness about this disease. And if you catch it early, it's treated. If you don't, it's quite hard. The brain fog, everything that comes with it, it's hard. My brain is one of my only assets. I'm an engineer. But that's what I use to make a living. And when I can't use it, I don't know what else I can do. You be the judge. Thank you.